everyone, and welcome again to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Today I'm going to talk about a very interesting topic where many women actually suffer in silence. I think many women actually, they have this itchiness that they cannot share because they feel so shy and embarrassed to ask everyone and how to solve it, and they just suffer in silence. And I know many women who have this itchiness again and again and again, and they don't seem to be able to find a solution for it, so they become very depressed and very desperate, don't know what else to do. Okay, so itchiness, vaginal itch, is actually very common, and many women keep getting it for a long time, some for months, some for years. They suffer in silence. So to help all these people, please share my video so that more women will get more knowledge about how to solve their vaginal itch problem. Okay, let's start with this topic we call vaginitis, the itch. This is the topic for my video today. Okay, why I gave this topic was because there are many people who actually post it up. I received a few private messages from a few people recently asking me regarding this topic. So I decided to do it. Actually, many months ago, I did do one that's already in my YouTube channel on vaginal discharge. But that was on vaginal discharge as a whole. Some with itchiness, some no itchiness. But today I'm just going to concentrate on those with itchiness only, because that is the one that is the most distressing to a lot of women. So if you have missed my previous video, please go to my YouTube channel, Dr. Tan City Clinic. Please remember to subscribe and like my video after you watch it, okay? Alright, so let's start. Vaginitis or the itch. What is vaginitis? Vaginitis is infection of the vagina. And not all infection of the vagina causes itch, but majority of the infection of the vagina actually causes itch. So when you have itchiness down there in your private part, there are many possible reasons, but the commonest reason, which is almost 90% of all women, when they have itchiness down there, it is only due to candida. Candida or candidiasis, this is the word you get whenever your doctor do a pap smear for you, or do a swab test for you, or do a culture test for you, and then you go and get your report and you see the word candida. You know how to spell? C-A-N-D-I-D-A. Candida. Or candidiasis. C-A-N-D-I-D-I-A-S-I-S. Okay, so this word candida, what is candida? Candida is a fungus. It is a fungus. So 90% of cases of women with itchiness down there is due to candida. One thing that is a good news for all of you who have itchiness down there, if it is candida, there is actually no danger at all. Because candida doesn't cause any problem at all to a woman's health other than itchiness. So itchiness is the only thing you need to endure, and other than that, there is no problem at all to the women. Because many of women who come and see me, they're actually worried, will this cause infertility? Will this cause other problems, cancer or whatever? The answer is no. For candidiasis, the only thing that it can cause is itchiness. So no worry. If you have candida and your report comes out candida, so no worry. The only thing that can happen is itchiness. Okay. Then there are other causes as well. So other causes of vaginal itch, it is due to other infection. You have bacterial infection as well as parasite infection. So these two I will talk about as well later. And last of all, before I end the topic, I'm going to talk about other causes of itchiness that is not due to vaginitis and not due to infection. Okay, let's start on candida. Candida is a fungus. Why does the candida come? Why does a woman get candida? You must understand, our vagina originally is already meant to have its own protection It has its own protection because they know down there, vagina, very prone to infection. A lot of things can come in. It's never a clean area in our body anyway. It's never clean and never meant to be clean. So that is why our body already originally have a protective layer that covers the entire vagina and the outer part of the vagina to make sure that we are free from infection. What is this protective layer? This protective layer, we call them probiotics. Basically, they are good bacteria. The good bacteria in our vagina and in our private part protect us from infection like candida. Then why do women get candida? The answer is so simple. Most women are very clean. They always try to make sure that their private part is clean. They wash all the time. They use all kinds of things to wash. They don't just wash outside. Some of them wash inside. They do all kinds of things to keep themselves clean. They wear panty liners in their panty to keep their panties clean. And because of all these practices, that is why eventually they destroy the original protection of the vagina and the private part. Okay, and the outer part of the vagina. We call it the vulva. So the vulva plus the vagina, the protective layer is all gone because of over-cleaning. Over-cleaning is the biggest problem. It's the biggest problem. And the problem is once a woman have itchiness, instead of first thing go and see gynae, they shy They shy to expose all these things. So they try, maybe I'm not clean. Let's clean it more. Let's clean it more. And because they clean more, they end up having this problem. Endless. I tell you, you feel good when you clean, but the itchiness comes back after that. That is the problem. You feel good when you clean it, but it comes back after that. So it becomes an endless problem. So you want to end this problem, number one, you have to stop cleaning all the time. My general advice for women is, every time you go and bathe, you use just water, no soap, no feminine wash, no Dettol, please. No Dettol, please. Because Dettol is not going to clean, it's not going to kill the candida. Dettol is going to kill the protective layer. No soap, no feminine wash, and no Dettol. Just water. Just clean with water when you go and bathe. And then when you go to the toilet, okay, some people when they go to the toilet, they just wipe. But some people, they go to the toilet, they want to rinse, they want to wash. You can rinse, but please don't wash. You can wipe with the tissue, just wipe, no issue. If you like to use water, by all means use water, but rinse only, not wash. There's a difference between rinse and wash. And you know a lot of things about public toilet. They actually have this thing that is like a nozzle, the water just spray in. Oh, don't ever use that to wash, because the water will just spray into the vagina and clean off everything from inside without you realizing it. Many women don't realize. Like for example, you just gone to the toilet. When you go to the gynae clinic, right? Let's say you go gynae clinic, then you think, I better wash before I see the gynae. So you go to the toilet, and then you use the nozzle, and then you spray, and then you come and see doctor. You know what will I do? What will I see? So when I do an examination, I will look inside the vagina, right? You actually see a whole pool of water inside that is still inside. You don't feel it, it doesn't flow out, but it's still inside. So that is the amount of water you flush in and wash your whole vagina, and at the end, even your protective layer is gone. So the biggest problem for why women get candida today is over cleaning. And one of the reasons why they over clean, number one, yes, women inherently, they tend to be clean. You see, a lot of women tend to be more cleanliness very particular about cleanliness. So they tend to be clean. The other thing is, there's so many products out there advertising every day, feminine wash, all kind of female products. And douche is what? It's the one where they pump inside and wash the whole vagina. There's all these products out there in the supermarket, in the advertisements, you see it every day. And at the same time, You can see it in the pharmacy. So you use it. You use it because when you have problem, you never ask how to solve the problem. Instead, you go and try and find your own way. And that is when you end up watching all these advertisements teaching you and asking you to buy this, buy that, buy that. And then at the end, you end up more and more clean. And then at the end, this candida never end. So typical of cleaning is when you clean, you feel well, but it comes back. You clean, you feel well, but it comes back. So that is why when you have vaginal itch problem, first thing you need to do is stop washing. Stop washing the whole day. Just wash when you go to toilet. Just wash when you take your bath, but only water. Go to toilet when you pee and poo. Try to just wipe. If you have to use water, you only rinse. Don't wash your private part and your vagina in the bathroom and in the toilet again every time you go toilet. Don't do that. Your protective layer will be gone soon. Then second thing is the use of panty liner. There are a lot of women who likes to use panty liner just as a routine thing, every day they put panty liner because they feel that the underwear is very dirty, got a lot of discharge, so they put panty liner to keep their underwear clean. But you realize that when you use panty liner every day, your discharge never ends. Women that have good protective layer, their panty is clean one, always clean. Maybe just during ovulation, that few days, a lot of watery discharge because of ovulation. The rest of the time is very clean. So one of the reasons why your panty is not clean is already because you're too clean, and therefore you have a lot of discharge, and therefore your panty is always full of discharge, and you want to use panty liner. And now you use panty liner, the humidity inside encourage more growth of bacteria and candida. As a result, you got more infection and you have more discharge. And the cycle goes on and on into a vicious cycle that your problem cannot end, and you buy more panty liner. So who are the happiest people when you have the itch? Two people, two companies. The panty liner companies and the feminine wash companies. These two people become rich because of your cleanliness. Because if you don't do that, you don't overwash yourself, you don't have discharge, and you don't even need to use panty liner because your panty is clean. So if all women do not overwash themselves, the panty liner company and the feminine wash company have nothing to sell. So because we are so clean, we end up making them rich. So first thing we need to do is to stop that. The second reason for candida, first reason is over clean. Second reason is sweet, over sweet. So that's why every time when women ask me, why I got candida, why I have this infection, no end, 2 years, 3 years, still like that, seen tons of doctors, my answer to them is so simple. You are either too clean or too sweet. If you look at diabetic women, they can have candidiasis from January till December, no end. Especially when their sugar control is no good. So for a woman that comes and see me who is slightly older, maybe in their 40s or 50s, when they have candida, especially if it's new to them, I will always ask them about their sugar level. Maybe they are diabetic. They don't know they are diabetic. So when all this itchiness come, then only we ask them, is it diabetic? Do you have diabetes? Let's test. Younger women, most likely not. Can, but rarer. Most younger women are because they're too clean. So either you're diabetic or you're borderline diabetic and love to eat sweet things. So all these people also will have this candida problem. So you're either too clean or too sweet. Okay? If your answer is candida. Other than candida, what else causes itchiness? Some bacteria also can. Bacteria like E. coli. These are bacteria that actually stay in our bowel, and sometimes when we pass motion, if the way we clean it is from the back to the front, so we can accidentally introduce this bacteria from our feces to the vagina and cause itchiness as well. And last of all is parasite. Parasite, that one is a sexually transmitted illness. Oh, that one is so itchy. That one is so itchy. Very itchy and very smelly. When you have that, it is usually due to sex, and that one is sexually transmitted. Okay, it's a kind of STD. So sometimes how you know which is which? There's no way you can know. The only way is you need to do a test. And the easiest test to do is pap smear. Because pap smear can tell whether it's candida or it's a parasite. Whether it's candida or the parasite. So it can tell. Trichomonas is the parasite. So you can tell whether it's a trichomonas or a candida. So when you know it's a trichomonas, you know it's STD. The medicine is different and need to treat your husband or your partner, sexual partner. If let's say you have candida, all we need to treat you. It has nothing to do with your husband or your partner. So we just need to treat you, and pap smear can tell the difference. Okay? So that's why every time if you have itchiness, all you need to do is do that. But you can't detect bacteria through your pap smear. So sometimes you may still need to do a swab. When you do a swab for culture, you can detect both candida and bacteria, but you cannot detect trichomonas, you see. So both tests is very important if you really want to make sure you know exactly what's happening. Okay, so only for candida is due to too clean or too sweet. And candida is the answer for 90% of women with this itchiness. Okay, so now you know. That's one thing you know about infection. And most of you, I'm sure whenever you have itchiness, most of you are actually only having problem with candida. And candida is also worse during pregnancy. In pregnancy, it's so difficult to get rid. It's partly because pregnancy is a very sweet state. It's a state of pregnancy. Women tend to be sweeter. The body tend to be sweeter. So it is more difficult to get rid of the candida. And plus the medication we can give is very limited because you're pregnant. So it's more difficult. But in normal situation, you should be able to get rid of candida by number one, other than medication, is lifestyle changes. In fact, you ask me, lifestyle changes is very important. There's no point taking a lot of medication if you're not willing to change your lifestyle. Meaning, you cannot be so clean anymore, lor, and you need to cut down your sugar. Okay? Okay. Other than itchiness, other than infection, what are the other causes of itchiness? You can still get itchiness due to allergy, especially allergy to menstrual pad. Allergy to menstrual pad, you will know one. You only get the itchiness at the end of your menstruation. Say your menstruation 5 days, day 3, 4, 5 only start the itchiness. And then after your menstruation over, day 6, day 7, maybe another 1, 2 days, you still get itchiness. And then after that, itchiness go away. So because your itchiness is purely due to menstrual pad. If you have menstrual pad allergy, then all you need is to change to two possible things. One is change to cloth menstrual pad. Because you can change brand, you realize it's all the same. You are usually allergic to the synthetic material of the menstrual pad. Menstrual pad nowadays are very, very, very sophisticated. They have so many things inside there to be super absorbent and leak free and things like that. And as a result, some of us can actually get allergic to the chemical components inside. So what you need to do is to switch to cloth pads, or the other way is to switch to tampon. That is for allergy. Of course, there are other allergies as well. Some people are just allergic to certain cloth material of your panty that is not cotton. That's very easy, just change to cotton. And some women, they are very interesting one. They eat certain thing, then down there itchy. They eat certain thing, down there will be itchy. It's food allergy. That one you can also identify because it's usually the same food stuff. And last of all, which is something that is a bit worrying. So does vaginal itch cause any possibility of life-threatening problem? The answer is yes. Yes. Vaginal itch can be due to cancer. It can be due to cancer. Although I would say 90% of vaginal itch is due to candida, in the very, 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 very rare, maybe just 0.0001%, it is so rare that you can actually get cancer of your private part. When you get cancer of your private part, or we call vulva cancer, it is super itchy. It is super itchy. And this itchiness does not go away. So normally, this cancer doesn't come overnight. It is usually very typical. You start with infection, and then you're always having infection, and you're always itchy down there. And then after that, over time, the skin start to change color, become thickened, and very pale looking skin. And then you still itchy, so you still scratch and one day this patch of itchiness turned into an ulcer, and this ulcer is not painful but is itchy. So ulcer that is not painful but itchy we have to suspect cancer. So usually women with vulvar cancer, it's not itchiness for one day, 2 days. They have been itchiness for years. It may be 5 years, 10 years, 20 years. So vaginal itchiness can still be due to cancer. Very extremely rare. Very extremely rare. I'm not going to scare you. I don't want to scare you because so rare. Even as a doctor, like a gynae, where we see patients every day, we also maybe see 1 in 10 years, you know. So it's so rare. So most important, if you have itchiness, please make sure you settle it and you solve it and end the itchiness, then you don't need to worry about cancer, okay? If you want to know more about vaginal discharge, I actually have another video on vaginal discharge in my YouTube channel, Dr. Tan City Clinic. Yeah, you can go and visit my YouTube channel and you please subscribe here and like my video. Over there, I have more explanation on all the causes of discharge. Today, we have all the causes of itchiness. Okay. When should a lady start to do pap smear? How about 30 years old and above and no sexual activity? No sexual activity, no need to do pap smear. We usually only do 1 year after you start sexual activity. So you don't do pap smear unless you have sexual activity. Candida treated by oral antibiotics or pill insert into vagina? Both. Both is possible. You can use either one as long as what you're using is an antifungal, not antibiotics. Because for Candida, it's a fungal, so you need to take antifungal, yeah? After birth, how soon to do pap smear or HPV swab? The KKIA told me not to do pap smear, but do HPV. Actually, it doesn't matter whether it's pap smear or HPV. Both things have a different purpose. But of course, HPV swab will not detect Candida. Only pap smear will. Either one will do, and you're supposed to do after childbirth, usually within the first 2 months. If the pap smear and results showed that the discharge has Candida, but no itchiness, need to treat or not? Okay, if there's no itchiness, you may not need to treat, but you need to do some lifestyle changes. Because when you have no itchiness, it only means one thing. The Candida is inside. It's inside. But it will flow out eventually if it's not out. If it goes out of control, if it becomes too much, eventually it will flow out. And when it flows out, it will be itchy. So taking the antifungal is possible, not wrong either, but if your lifestyle changes don't change, it doesn't actually end this problem. So you want to end the problem, you need to change your lifestyle. Actually, most importantly in Candida is change lifestyle. So of course, if you have itchiness, then normally we need to take treatment lah. You know, it's so irritating, right? And because if I don't give you some antifungal, then you end up washing and do all kind of things. I think it's worse. Okay, it's better you take the antifungal so that you don't wash. Don't keep washing, okay? Most importantly, don't keep washing. Do you recommend probiotic for candidiasis? Most importantly, you need to change your lifestyle. Because you can take all the probiotics you want, but if your lifestyle don't change, then probiotic is not going to work. If you want to take probiotic, of course can. I strongly advise, but your lifestyle need to change. Because I still have a lot of women who take probiotics for years and years and years, and then they ask me, why I take so many years probiotic but it doesn't work? Then you ask them about lifestyle, their lifestyle haven't changed. If your lifestyle haven't changed, your probiotic is not going to work. So the most important thing is lifestyle need to change. So when women come to me with Candida for a long time, I don't usually prescribe probiotic first. I will ask them to change their lifestyle. If their lifestyle don't change, you are just wasting your money with probiotic. Okay, Eva, the lifestyle is mentioned in this video. Please watch the video again, yeah, after this. Okay, alright, so Candida is purely due to lifestyle in women. Okay, so in summary, if you do not want itchiness down there, it's very simple. Don't be too clean and don't be too sweet. That's all. Okay, so that's all for now. Anything, you have any questions at all to ask, so please, you can private message me. From there, I will pick my questions for my weekly Sunday 9 PM live video. We have so many videos already out there in my YouTube channel since last year, but I know there are still a lot of questions out there that I have not answered. So if you have any question, please privately PM me. Alright, so stay tuned. See you next week, Sunday 9 PM. Bye bye.